Next, we have Pierre from Switzerland. Is there any natural way to drain any of the unwanted stuff that's found in the vaccines? So, Dr. Malone, would you mind taking that one first?
Yeah, I get this question all the time. I just got it last weekend in Santa Barbara. One physician that is actively practicing in Northern California is recommending the combination of ivermectin and potentially fluvoxamine. Ivermectin in particular seems to have some benefit in displacing or competing for binding sites with spike, and may have benefit in the post-vaccination syndrome. There's many anecdotal reports of that, but I'm not aware of solid clinical trials supporting it. There's a variety of different post-vaccination syndromes, and one of them involves the binding of the spike protein to platelets, apparently, and the subsequent development of an autoimmune syndrome. We could call it ITP or TTP. This thrombocytopenia that is immune mediated seems to be fairly common. So that's what I have to say in terms of clearing the RNA. I'm criticized often for having created this tech, and sometimes I feel like Oppenheimer in that sense. But what we have here, as we mentioned earlier, is not really a RNA. It's a synthetic single-stranded polynucleotide that can be translated to produce proteins, but it is a very artificial molecule. It has this base called pseudouridine in it, and it appears to be resistant to normal nucleases, things that would break down DNA and RNA, natural DNA and RNA. So I don't have any advice about how to clear that molecule. I look, perhaps Dr. Cole or Dr. McCullough have had some brainstorms in the absence of anything that I can contribute.
Dr. Peter?
I don't have any suggestions. People are alarmed with the two observations. One is that now the messenger RNA is known to be in the body much longer than we ever imagined, and then the persistence of the spike protein. And there's a lot of remorse. People are remorseful for taking the vaccines, and they want it out of their body. There's almost an anxiety there. I can tell you clinically, people in my family have taken the vaccine. I'm watching them carefully clinically. I think the majority of people who took the vaccines are fine. They haven't had any problems. The body is probably undergoing its normal phagocytosis and clearing these out of the body, and provided there's no boosters taken, my anticipation is clinically they'll be fine. I do worry about people taking progressive boosters, where even from shot 1 to shot 2, we now know the messenger RNA is not out of the body. And then to take an immunocompromised person would actually take a shot 3 within a month. There's 3 shots in 3 months, and then up on an every 6-month schedule. I think at that point in time, there's going to be clear accumulation of messenger RNA and accumulation of spike protein. It all depends on where it accumulates in terms of what clinical syndrome develops. I am treating the clinical syndromes, and I agree. I think the neurologic syndromes appear to be responsive to fluvoxamine. We need randomized trials. There are those who are using ivermectin with this anti-spike protein capability. I still think there's some syndromes that need corticosteroids in addition to fluvoxamine or ivermectin. And then I'm very wary of the thrombotic syndromes. And I'm starting to form a clinical feel that the thrombotic syndromes may be related to the intensity and severity of spike exposure, as well as the repeated spike exposure. So someone having shot 1, shot 2, having the infection, and then having a booster, for instance, like 4 different exposures to spike protein, and then ending up with a pulmonary embolus. And my clinical practice is busy now with these thrombotic syndromes.
I'll add my 2 cents real quick. I agree a lot with Dr. McCullough on this in the sense that most people are fine. The unfortunate studies we don't have yet is what percentage of people genetically are different and do hold on to production of the spike longer than others. So there are a lot of studies that need to be done. I agree with him. Here's some interesting clots, the long stringy ones. Here's some slides of them. I've been studying these. These aren't normal clots in the sense that they're more of an amyloid proteinaceous clot. They're not your typical, bunches of platelets and whatnot. Fibrin can be broken down. There's a natural enzyme eaten a lot in northern Japan, the fermented soy called natto. So there's an enzyme called nattokinase that actually really is a good fibrin breakdown product. So some of these chronic small or large clots, they are more difficult to break down than others. I think the other thing too, those that are consistently producing spike, if you can inhibit that spike from binding to your ACE2 receptors, some people will take Nigella sativa, which is cumin black seed oil, which inhibits spike binding because it has natural quinines in it. And then the other factor I think that gets missed a lot in some of these post-vaccine long haul patients is reactivation of other viruses. So you may not actually be treating the persistent effect of the spike per se, but rather herpes family viruses, especially mononucleosis. So it behooves any of the patients that are having these long haul symptoms, be it from microclotting, certainly try to treat that, but also check some blood panels, see if you have reactivated mononucleosis. I have many colleagues that are seeing it left and right and in numbers they've never seen before. So that's my 2 cents worth.